Today we're going to talk about strain counterstrain. Being able to perform strain counterstrain correctly, it's important to learn each step. First, we're going to learn to locate the tender points. Once you locate that tender point, then we're going to put the person into a treatment position. We do that by finding the position of comfort. Each tender point has a corresponding treatment position that is in your manual. Once you find that position of comfort, you'll learn to find what's known as the mobile point. That's the point in which the tissue completely relaxes and lets go, and the individual will report that they have no pain anymore. Once you find that position of comfort or mobile point, then you will monitor that point response. It's important at this time, though, to remove your pressure of your finger off that point. You're still monitoring it, but you're not pressing down because you do not want to give too much input to the tissue at that time. When you're in that position and you're monitoring, you're going to hold for 90 seconds. At the end of 90 seconds, you will return that individual slowly back into their neutral position. It's important that you go slow, that you're having the person relax completely, and that you're doing it passively. Once you're done and got the back into position, then you need to recheck that tender point by pressing just hard enough to blanch your fingernail, and the individual should have 70% improvement in order to have successful treatment. Now we're going to show you how to locate the tender points. We're going to start first with the anterior thoracics. The very first point is up at that sternal notch. You'll put your finger into the sternal notch and then you'll press down inferiorly. You want to press just enough again to blanch your fingernail, and what you're looking for is to see if the tissue is full or thick. Then you're going to look for a response from the patient to see if they're tender. A positive tender point is 4 times more tender than normal tissue. The second anterior thoracic point, you then move onto the middle of the manubrium and you'll push straight back. Again, just blanching that fingernail. Anterior thoracic 3, just over the sternal angle, pushing straight down. Anterior thoracic 4 at the level of the 4th interspace. Anterior thoracic 5 at the 5th interspace, approximately level with the nipple line. Anterior thoracic 6 is on that junction of the xiphoid process. Be gentle with this one as you push down. This next group of anterior thoracic points is different than what I just showed you. Previously, we were using just a single finger and pointing at one point. When you start at anterior thoracic 7, you're going to be using both hands to palpate. But even though I'm palpating for 2 different points, you have to do first one side and then the other. Don't press both at the same time. Anterior thoracic 7, you find that by feeling the edge of the ribs right here where it V's. Then at that level of the interspace of the rib 7, I'm then going to go down into his ribs. Then I'm going to pull out toward the side. Ooh, that one's tender. Then we'll do the same thing on the other side. See, look at the tissue is much softer here, and it's not nearly as tender. So let's show that again. That's a tender point here. It's very thick. It's very full. He does not like me putting my finger in there, and it's quite tender for him. Anterior thoracic 8, directly below anterior thoracic 7. And now I'm not pushing out so much, I'm just pushing straight down. You'll see how you have to be soft as you go through the tissue and then push. Anterior thoracic 9 is just above the umbilicus, pushing straight down. First one side, a little bit more tender on that side, but not real sharp. So it feels thick, it feels full. I'm guessing we're going to find something with the next point. Let me go to anterior thoracic 10. Where's this side? Yeah, it's this one. That one's more tender for him. Okay. Anterior thoracic 11. Now you go down and find your ASIS, but you have to be in line with the points you were previously. So I'm down here in line with ASIS, and I'm going to push straight posterior. First one side. Oh yeah, a little bit right there. Okay. Again, what we're finding when it's tender is it feels thicker, it feels fuller, it's a little more resistant as I push down, then the patient will respond and tell you that it's tender as well. Anterior thoracic 12, now you go up onto the crest of the iliac. You have to soften your fingers as you go into the tissue. If you don't, the tissue will seem tender because you're pushing too hard. So soften your fingers, go up, and now you get on top of that crest. One at a time, I'm going to pull down and then pull down. So a little tender on that side, but not too bad. Okay, now we're going to show you treatment for the anterior thoracic points. Now, you're going to notice that some of what I'm showing you is different than what's in the manual. That has to do with the fact that Dr. Jones, who came up with strain counter-strain technique, stood about 6'3" and had hands about this big. So many of us change those techniques to make it physically easier for us. In addition, I also find things that are more comfortable for my patient. The key is, am I still shortening the structure that corresponds to the tender point? That's what's significant. So for that anterior thoracic 1, which was in the sternal notch and you were pushing inferiorly, and then anterior thoracic 2, which is in the middle of the maneuver and pushing straight back. If either of those points should be positive, it's a matter of getting hold of that individual's forehead, making sure that their back is supported into your tummy so you've got a good hold of them, and then they can relax. You'll ask your patient to take a nice deep breath, and as they breathe out, I'm going to let him drop his head. And I'm going to control the motion, and as he flexes, I'm allowing both his upper back and his neck to flex, and I just keep moving him as I monitor that point, moving back until I feel a complete release of the tissue of the tender point. Once you find that treatment position, I'll retest by pushing down again. If I need to, I will fine-tune the position a little bit, and then my finger remains there to monitor the point without any pressure though. We'll stay there for 90 seconds. And during this time, I find it much more helpful to tell my patient to just take a deep breath and breathe out, rather than trying to instruct them to relax. Generally, when you use those words, the patient tends to tense up. Once the 90 seconds is complete, then we're going to return to neutral. I want you to notice how I'm going to first take him sideways and kind of round him up as I come. That helps him to be less willing, and it discourages him from actively contracting. Once you're done with that, then you retest the tender point, AT1 and AT2, and you're looking for 70% improvement. Now, for AT3, 4, 5, and 6, that treatment's a little bit different. This time, we're going to have the patient move back on the table just a little bit more. Good. You do want to make sure that their feet are securely on a surface and they're not just dangling. Then I'll use a pillow between myself and the patient. From this position now, I'm just going to take those patient's arms off the back of the table. We're going to have him take a nice deep breath. Now, when he breathes out, again, I find my point, then I get him to breathe out and relax, and as he relaxes and leans into me, I'm flexing that thoracic trunk. Another deep breath. Once I feel that the point has relaxed significantly. Then I fine-tune by using the arms, and I can use my body to push him down into flexion a little bit more. You want to make sure that that point is completely relaxed. The finger is monitoring the point without significant pressure. You'll stay there for 90 seconds. When the 90 seconds is complete, then you reverse back into neutral. I do that by moving the patient's arms for them. I get him to stay nice and relaxed into me, take him to the side, and slowly bring him around to discourage him from actively contracting. Once they're back into position, then you will retest the tender point, looking to see if it's 70% improved. That shows you the treatment for the points of AT1 through 6. There's 2 basic positions, AT1 and 2 using the head, 3 through 6 using the arms and the body. All right, next we're going to show you treatment for anterior thoracic 7 points, which were here, anterior thoracic 8, and anterior thoracic 9. Actually, right here, he's just a little bit tender at that spot right there. So we're going to treat this one right here. He's going to sit up. And I'm actually going to sit him so that the footstool now is off to his left a little bit. That's going to help me side bend his body. His tender point was on this side here. I'm going to put the pillow on my leg on the opposite side and put that arm over the pillow. Then, when I do that, now this leg, when I move it out here, this will cause the trunk to side bend toward that tender point. Then we'll reach this arm gently across to the pillow, passively. Get him to take a nice deep breath. When you pull this arm across, it causes the trunk to rotate away from that tender point. So I'm side bending toward and rotating gently away with some mild flexion. Now I'm going to find that point again underneath the ribs. He's going to take a nice deep breath for me so I can be sure that his body's relaxing and I'm doing the movement for him. Good. I'm just translating him back and forth on my leg, getting him to relax, side bending toward, there we go, rotating slightly away. Good. How's that feel?
Good.
All right. Then I will monitor the point, but not give a lot of pressure. Ease up my pressure. Stay there for 90 seconds. Once the 90 seconds is complete, I like to have him, I hold on to him steady, and I like to have him take his legs off the stool. Good. And then we just gently bring him back into position. And we repalpate the tender point. That position you can treat 7, 8, or 9. The difference would be is how much side bend, how much rotation, and how much flexion is needed to be able to get that specific point to relax. Next, we're going to show you treatment for anterior thoracic 10, which is just below the umbilicus, pushing straight back. Anterior thoracic 11, across from the ASIS, just down from that anterior thoracic 10, reaching straight down. He's got just a little bit right there. And then anterior thoracic 12 at the top of the crest, pushing inferiorly. A little bit right there. Okay. For this one, we're going to have him bend both of his knees. Now, if you have a table that elevates the upper back, you can use that. Very few of us have that luxury. So instead we do something a little different. We'll take a pillow, we'll put that underneath his pelvis. This is going to help us to flex him up passively and gently. So we found one point right here. We're going to bring both of those knees up into flexion. I like to reach over then and take advantage of having the pillow. I'm still monitoring that point. We're going to flex him first until I begin to feel relaxation. There it is. At that point. Then you slightly side bend and rotate toward that point. You can kind of think about the fact that the knees are going toward the tender point. Again, I'm monitoring with my thumb for that tender point. There's no pressure on there. I do test every so often just to be sure we're in that most comfortable or mobile point position. Once 90 seconds is complete, you just slowly reverse what you did by getting rid of the rotation and the side bend. Reach to the bottom of the feet to make sure they don't contract. Bring them all the way down, stealing the pillow out, and then retesting the point. Oh yeah, much better. Good. Now, palpating the posterior thoracics is a little bit more challenging. First, we'll start with posterior thoracic 1 and 2. For those, of course, you're going to find C7, then you'll go directly below. Notice that I've got that spinous processus between my fingers. Just like with the anterior thoracics, I'm going to be using both hands, but you do one at a time. I'll start with my right hand. I'm on the side of the spinous processus, and I'm pushing my finger against the side of the spinous processus. First one, and then the other. We do that for posterior thoracic 1, 2, 3, 4, and 5. Ooh, a little tender right there. On this side right here, a little bit more full tissue, and he's quite tender. Now, so for posterior thoracic 1 through 5, I was on either side of the spinous processus, and I was pushing the pad of my finger up along the spinous processus. When I get to posterior thoracic 6 through 9, now your fingers are no longer going to be on the spinous processus. They're just lateral to the spinous processus in that paravertebral area. Again, using both fingers, pressing one at a time. Going straight down, 1. So I'm on posterior thoracic 7. Ooh, a little bit still right there. Not as bad as the other one. 8. It's kind of got a row right here that's tender. 9. And then that 9 stops it. So 6 through 9 is in that lateral area of the spinous processus in the paravertebral area. When you get from T10 to 12, there can be a tender point either on either side of the spinous processus or in that lateral area to the spinous processus. I find it's best to palpate both. Since I was working my way down laterally, I'm going to go ahead and just continue that. We go to 10, 11, pushing straight down, and then 12. And then I can just turn my hand, oh yeah, a little bit right there. On the spinous processes, I work up 12, 11, and 10. That completes the posterior thoracics. So, posterior thoracic 1 through 5 on either side of the spinous processes. From 6 to 9, just lateral to the spinous processes in the paravertebral area. 10 through 12, either along the spinous processes or in the lateral aspect in the paravertebral area. Next, I'm going to show you treatment for posterior thoracic points. Of all the points that I've taught you thus far, these ones will vary from the book the most. Again, I've just changed them, these ones, mainly for my patient's comfort. For posterior thoracic 1 and 2, we found those by getting on either side of the spinous processes and then pushing the tissue toward the spinous processes. If we should find a tender point on this side, I'm going to have my patient bend his knees. I'm going to support his head and shoulders, and then ask him to bring his whole head and shoulders off the table toward me. A little bit more. Good. Then, if you want to, sometimes having a pillow in your lap just gives that patient that much more comfort that there's someplace safe for them if their head should drop. I've got the head cradled well in my hand. Then I palpate that tender point on that left posterior thoracic at either level 1 or 2. Now, he's going to just take a nice deep breath. You'll notice as the head starts to go into extension, I'm extending at the thoracic spine. I'm not doing cervical extension, okay? So the head actually stays quite neutral. What happens is as he takes that breath and drops down, I'm extending at that thoracic segment, just until I feel the tissue relax. Then you fine-tune by side bending away from the tender point and rotating away. A little more extension to fine-tune. There it is. Better? Mm-hmm. Good. My finger remains there to monitor without significant pressure. It stays for 90 seconds. After that, you slowly return them to position, get rid of the rotation, side bend, bring them back to neutral. I cradle that head well as he slides himself back onto the table. When the patient gets up from the table here, I like them to lay here for a little bit. When they do get up, I like them to roll as a log. Okay. I showed you how to treat posterior thoracic 1 and 2 by having the patient supine. Now I've turned them into prone position to treat posterior thoracic 3, 4, 5, 6, 7, 8, or 9. For these upper ones of 3, 4, and 5, if I find a tender point on this side of the body, I like to stand on the opposite side. So if I find a tender point, which was located right on the side of that spinous processes, I reach to that opposite shoulder. I cup my hand around that shoulder, and then I just gently bring that shoulder toward the tender point, which will create some extension and lateral flexion and rotation until I feel that point relax. You will monitor without a lot of pressure for the 90 seconds. Once that 90 seconds is done, you'll return to start position and then repalpate. Now, for this same tender point, you may use alternative ways to treat this depending on the build of your patient. Sometimes, especially these upper thoracic ones, you need to take that patient's arm up along the side of their head. That just shifts the muscles a little bit differently. Now, instead of reaching for that shoulder, I'm going to reach to that axilla area, making sure I have a good hold of the scapula. Again, just bringing it toward the tender point. You can try either one of these and see which one works best for you and the patient. Same principles of monitoring the tender point without significant pressure, staying for the 90 seconds, returning slowly and passively to start position, bringing their arm back down, and then repalpating. The last alternative position is some people have very large patients and they find reaching across difficult. You can get on the same side of the patient and you can cradle their arm into your elbow and arm area, palpating that tender point. Again, just bringing that shoulder up toward the tender point. So if someone had a very heavy arm, this might be easier for me because I can use my legs to do the lifting. Monitoring without the pressure, staying for 90 seconds, and then returning slowly back to start position, and then repalpating the tender point. Now we're going to show you treatment for posterior thoracic 10, 11, or 12. These points could be found by either palpating either side of that spinous processes or in the musculature just off to either side. He's more tender right there. For these ones, you're actually going to move the individual's pelvis. So if he's tender on this side, I'm going to reach across to that same side of pelvis. I reach underneath so I can scoop up by that ASIS. You want to make sure to use the nice fleshy part of your hand so that ASIS doesn't get irritated. Reach under there, grab hold. Using my body weight, then I'm just going to gently bring that hip up, creating extension at that point, side bend and rotation until I feel that point relax. I find sometimes with these points, if you provide a little traction on this arm at the same time, it helps him relax more. That feels better, doesn't it? Mm-hmm. Yeah. Monitoring without a lot of pressure there, staying for the 90 seconds. Slowly return to start position. And repalpate the tender point. Oh yeah, much better. Okay.